was in the administrator's office one day, and a woman walks in with a bouquet of flowers and a bunch of candy for the staff. And so I asked the chief nursing officer, I said, well, because they all seem to know her. I said, well, what happened here? I mean, why is she doing this? And she said, well, her daughter was here in the hospital. So my automatic assumption was we treated her and that she had, survived and gone on to do well. And I said, oh, well, we must have done a really good job for her daughter. She said, well, her daughter died in the hospital. And I said, what? And I said, well, why is she so positive towards us? And she said, it's because of the way that she died and the fact that we took care of her in a way that allowed the parents and the family, dignity and care and to feel like, we really cared about them. And she died in as positive a light as you can die, in a positive light as a young child. I never forgot that. It's the people we take care of are in need.
If you could give one message to our current or prospective MHA students, what would it be?
I would say that healthcare is a tremendous place to work. I have enjoyed it immensely. And I've been able to get up every morning recognizing that I'm doing something that's making a difference in somebody else's life. The opportunities are there for you to do well financially, and for you to do well by your community.
If you don't mind, could you share a little bit more about what the academic accomplishment, what earning that graduate degree meant for you and meant for your family? How did that change you?
Coming from where I came from, education, the high school that I went to, John C. Fremont, a good school, but, we weren't competitive academically. I was on the chess team, on chess club in high school. I was also on the basketball team, so I got to balance that out. And, we played chess at Beverly Hills High, and we played chess at Palos Verdes Estates. You walk into those schools and the resources that those kids had, was just another world, way beyond anything that we had. We were still using old books at our high school. And so, many of the people who I grew up with, they went to work for the post office or they went into the military. There's nothing wrong with that. I'm not saying that in a disparaging way. I'm just saying that, what was open to us was very narrow because of who we were and where we grew up. And the fact that I was able to get through that needle, if you will, it started with a high school teacher who saw something in me, and she got me into the UCLA summer program, where I did my summer before senior year, and that gave me almost automatic access into UCLA. And there, I was exposed to a whole new world. First of all, not to get racial, but most of the people there were white, I came from a world where 95% of the people were black. And so now I'm exposed to just a whole new world, if you will, which in my viewpoint, you can either recoil from it or you can embrace it. So I embraced it. And I'm around people who have ambitions, right? And I'm around other black students who have ambitions. They want to be dentists, they want to be doctors, they want to make changes in the world. These were all things that were new to me. And so it's sort of, I guess there was always something inside of me that, if you will, that had this desire, and it just needed to be opened up and be able to see other people who do these things to say, yeah, I can do this as well. And so I started thinking about, okay, what's the next step for me? What do I want to do with this career? What do I want to do with this, with what I'm learning here? And that sort of drove me. It developed this drive to say, okay, I want to run a large organization. So what do I got to do that? My degree enabled me. I've been all over the world. That would not have been possible without that degree. I built a hospital in China. We negotiated contracts in the Middle East to buy equity in hospitals. Would not have been able to do all of that stuff if I hadn't had the degree and the academic background that I had. I am, secure, and my family's secure, and my family is secure for generations because of what I've been able to do, which would not have been possible if I hadn't had the academic background that I had.
To touch back on something you mentioned earlier, I'm curious about what inspired you to pursue a career in healthcare management rather than in another field within healthcare.
You got to remember, this is, I was in high school in the 60s. So it's an entirely different era from today. And back then, if you're African American and you're a kid, your parents pushed you in certain directions. So I went to UCLA as an undergrad as a pre-med student. And many of my friends were also pre-med students or pre-dental students. And back then, you could get into med school before you finished your undergraduate degree. And so a lot of my friends, they left after their sophomore or junior years. And I'm still sort of working my way through because in my heart, I did not want to be a doctor. I was pre-med, I had a molecular biology undergraduate degree. And I was, to be candid, struggling. I mean, organic chemistry almost killed me. It was just hard, and because I just didn't have the mentality for it, and I certainly didn't have the money to go to medical school. And so when I actually graduated, after I had transferred up to UW, the idea was, okay, what am I going to do? Do I want to go to medical school? Not really. I hadn't even applied. And so I looked into pharmacy schools, and a friend of mine told me I should look into hospital administration. And so I did, and I thought, well, this makes sense for me. It kind of felt like it resonated with me in terms of what I thought I could do and could be successful at doing. And so I applied here. I applied at a number of other schools, and I got accepted at all of them. But I wanted to stay here, and I liked the program here, and so that's sort of how I got in.
So I want to ask you a bit about your experience while you were here.
Well, you do realize that was almost 40 years ago.
Yeah, and campus is a little different.
It's very different. Yeah.
Something the program is still going strong.
Yeah.
In our second half century now.
Yeah.
So what originally drew you to this MHA program?
Well, as an undergrad here, I was able to get to go over and physically visit the space, whereas the other schools I applied to couldn't do that. I grew up in the inner city. I didn't get the greatest, under high school education. I didn't have the greatest grades as an undergraduate, but I did much better as a graduate. And part of it was the nature of the program and how they worked with me and helped me develop study habits, hooked me up with other people in the program that, who maybe had better advantages than I had that I could learn from. And all of that really made it, possible for me to have the achievements that I've had in my career.
How did your time here at the UW prepare you for the complexities of leading large healthcare organizations?
Well, that's an interesting question because, when you're in school, it's an academic environment, and what happens inside these institutions can be completely different. We got some exposure to what it's like in the real world, if you will. And I hate to use that word because both worlds are real. They're just different. Organizations have hierarchies and political structures, and they have personalities, and there's a bunch of personalities in those organizations, and that you have to be able to relate to and deal with if you're going to be successful. So I think what the program did for me was gave me a foundation to build on that was solid. Now, in order to succeed, the rest was up to me to figure out how to use that foundation to drive my career forward. But the other part of that foundation is confidence, in the sense that you know what you're doing, you believe that you can be successful. And so I left the program feeling good about myself. Honestly, I hadn't thought about this to this very moment. When I finished the program, I probably felt as good about myself as a person in terms of my ability to be successful in this world as I ever had. Growing up as a young black male in the inner city of Los Angeles, you're not exactly filled with people telling you you can do things, people pushing you. They're usually pulling you back, they're pulling you down, everything's oppressive. And so for me to get into the program and then to finish it, when I left, I felt pretty good about myself, that I had achieved something that no one else in my family had achieved, none of my friends had achieved. And so I felt like, I can make it in this world because I have the skill set and I have the basis to be able to do it.